Okay, I finally thought about it and figured out what I'm going to do here with this video specifically, because it gets a little bit sensitive for me and then I get angry, but like crying angry, and now I'm just angry with the more time I've had to sit here with it. But then it made me think. I'm angry, but I don't feel like, I know everybody processes everything differently, but I don't feel like anyone else is as angry as I am. I made a really fantastic fire and it is burning me up, and now I'm knocking everything down. That's me, a mess all the time. Here's my fire. Did a good job, but it's hot. Okay, so I decided what I'm gonna do. I'm going to remove all emotion from the situation. I am not going to give any commentary. I am not going to say anything other than exactly what's necessary to tell a story, so that hopefully what could go for eternity if I'm giving my commentary and emotions and all of those things, it was going to be a 3-hour video, and that ain't it right now, because I just got to get this story out there. But I decided, here's what I'm doing. I'm removing everything, all of my opinions, all of my commentary, everything. Will only tell you pertinent information as I would a doctor. And if that pertinent information just happens to also be just immature and like dickhead of the doctor, then that happens to be what it is, but it might be important to the story to understand where my lack of trust comes in. So I'm just going to tell you as if it is a story I was reading about, because I'm a medical student. I'm going to try to keep it as impersonal as possible. If I sway, there's nobody here to stop me, so I'm sorry. And I just want to tell it one more time and see what you guys think. Like, if this was you, if this was your mom, if this was your sister, if this was, it could be men, because I read that, there's 10 cases of this thing, and I believe 1 or 2 of them were men. So yeah, whoever is related to you, that's important to you, think about it if it was them or yourself, and tell me if I'm being crazy. After that, then I'll give, I'll post a second video with the other parts of that first video that, like, just right now feel too raw not to share, but too raw to keep the video from being an eternity long, because if I get going on that part of it, I'm not sure I'll ever stop, because I do know that I will never stop pursuing this until I know I'm okay. And then after that, if it's proven with no question that I'm not crazy and, something was left behind, or even if I am okay, I get like real confirmation from another doctor saying, yeah, this is like completely not just unprofessional, but like not done well at all. If I ever get that confirmation from another doctor, I promise I will not stop coming for this doctor's medical license. And people can be mad at me for saying that and think that, and I know it wouldn't happen. Trust me, I know it would never happen, because you would have to kill several people to lose your license. But what I can do is like make it known who this dude is publicly. And I haven't done that yet, because I am still being made to feel like I'm crazy. And maybe I am. So this video, hopefully you guys can let me know if I am. And then we'll get into all the other stuff if anybody else has curiosity about all of the other, my opinions on things and how I feel about all of it. Now we stick to facts. Okay, fact. Sometime in the last 5 years-ish, like closer to 5 years, 4 or 5 years, I had breastfed all 3 kids for a total of around 3 years. Literally half of that was spent exclusively pumping, not consecutively. It was like 11 months and 7 months. And then exclusively breastfeeding for 18 months with Macy. Because of that, I will put a disclaimer before this, but I'm going to back up and give a disclaimer. I'm going to say nipple a whole lot. But it is what it is. We're all adults here. And if your kids are with you and they are uncomfortable with the word nipple, then you may want to like not listen right now or watch. Okay. So after that, there was a tiny, very tiny growth on the left side of the outside of the outer left side of my left nipple. Sorry, that's like a weird thing. Every time I say it, it sounds weirder. So like here on the outside of my nipple. It was very tiny. It was there for several years. I had showed multiple doctors, you know, when I had my annual with my OBGYN, if I had something else, like I've had mammograms, I've had other things, and it was there, and they all just kind of shrugged it off like it was nothing, almost as if like it was just a skin tag that like just looked normal. It was always there, never bothered me, and they said if it bothers you, you can have it removed by a dermatologist. Now we fast forward to early August. We were on vacation in Florida. Fantastic time. I will tell you all about it the next time because it is a wonderful story where we went, give you guys some heads up on a cool place to go. When we got back, so we're like end of the first week of August, was in bed, reaching, had pain from that area. The itty bitty little tiny skin tag looking growth had grown to the size of like not the average size marble, but one a little bit bigger. Half of it was like, looked like that thing that grew and was red. And the other half of the larger size was a clear liquid filled blister. And it felt like a blister. I figured it was friction, bathing suits, ocean, sweat, all the things from Florida. It was Florida in August. It was very disgusting and hot there. And humid. So like, ladies, you know the girls were sweating. So I had assumed that it was like it just got angry because of that. So I had actually joked around because I'm like the creepy pimple popper, like I'm gonna pop this giant blister. And like the people that I had, you know, my peoples, my mom and Molly got pictures of it, and I told Molly I'm gonna pop it. I'll just like stick a needle in it. And I think I might have sent it to Shayna and Beth too. So like if you got to see that initial picture, you're lucky because it was disgusting. So eventually I did not pop it. It did pop, I think. I don't remember if it was overnight, the next day, whatever. It did pop, and I cleaned it up, put like Aquaphor on it, put a Band-Aid on, went about my business. And then it was just bleeding, and it would stop bleeding when I had a Band-Aid on, but then when I took the Band-Aid off, it would start bleeding over again. And I'm like, don't love this. So that only happened for about a week. So on August 18th, I went to a dermatologist who I had used their practice prior to that. Macy had something on her ear removed, and I had a great experience with them. And again, everybody told me this was like a total non-thing, and I'm just thinking it's like friction. So like I've been meaning to get it off for years just because it was ugly. So now I have a reason forcing me to do it. Like I said, it was August 18th. I got into the dermatologist's office. It was like I got up at 7 in the morning. I think I was in there by 8:30. The doctor was not overly impressed, and she said, yeah, I really just think it's an inflamed skin tag, so we're gonna remove it. We biopsy everything, schedule an appointment for, I don't know, it was like 3 weeks or something, whatever it was. So I did. Fast forward the 3 weeks, I actually made a joke to somebody like, if I haven't heard from them, like it was almost the time for the appointment on a Monday. It was supposed to be, September 8th, Monday, September 8th. I think it was like Friday, Saturday, or Sunday. I had said to Molly, you know, I'm if you don't know Molly, Molly is like my person, besides, you know, my obvious person. We like co-parent our children, basically. She does a lot more than I do usually, but she is my Molly. So if you do know Molly, you're lucky. I said to her, like, that the weekend before, like, if I haven't heard anything, I'm sure I'm fine. Like, they always say, we'll call you if it's something, and not if it's nothing, like, whatever, you'll hear from us sooner or whatever. So I'm like, I haven't heard from them. It was a skin tag, whatever. She's like, maybe not, but yeah, probably. Okay. On Monday, I got like a text message. It's time to check in for your appointment. Click here. So I did. And I do the check-in thing and I'm like, oh, results. Let's see if there is anything. I don't recommend anybody do that. I said no commentary, but no, don't do it. I opened the results. It said invasive squamous cell carcinoma. I looked it up. It is the second most common type of skin cancer. The first is basal cell carcinoma, and this is the second most common. However, when I keep saying that I have rare cancer, it is not the type of cancer, because like I said, that's the second most common. Typically, like if it's just, you know, a tumor like that, they remove it and you're usually good. Obviously, if you're prone to that, things could pop up elsewhere, but it's not related to that spot. Like that spot's good. So very common on skin. The problem was mine was on my nipple, and both the nipple and the areola are not considered skin. They're considered tissue. The areola is more like skin, but still different. And it's like, I'm not a scientist, so you're going to hear some things the way I'm explaining it. If you are a doctor or scientist, you're probably like, that's not at all what it is, but it's just the way I'm saying certain things. I don't know the right words to use, so I'm explaining it to you as best as I can, because I don't know how else to describe it, but I understand it, so I know that's weird, but it'll make sense. So yes, the areola is also considered tissue, but has more similarities with skin. The nipple itself, though, because there are ducts involved and things like that, is considered a much more risky place for anything. The reason I say it's rare is there have only been 10 that I can find, according to the American Cancer Society, and there was one other reliable source that I found. I don't like read Wikipedia and believe the first thing I read. Don't worry. I've had to do this my whole life. So I knew right away there was only 10 cases of this, but at the time I thought that I read like 10 to 15 in a year or two time period that they were like looking at it. But I was wrong. There have been 10 reported cases total in all of time. I don't know if they keep track of, if the American Cancer Society keeps track of any other countries, and I know that sounds super ridiculously ignorant, but I don't know. Maybe, I don't know. I don't know how that works. But 10 reported cases in history of this type of cancer. So I'm number 11, and no one else, according to every other doctor that I've seen, and I know I said I wasn't going to give any other things because I want to see if I'm crazy, but I did read that there was only 10 or 15 cases, which I thought was in a year, but I still thought that's not like a lot. And that's all I knew at the time. So I know now that it was only 10 total, so I wasn't as angry then as I am now. But that was only because I didn't know. But now I know there's only 10, and I would be number 11 in all time. So I went back. The doctor told me what it was. I said I already read about it. She said, please don't do that. And she was probably right, because if I would have not read anything, then I probably would be fine and about my business right now and do whatever. So, but I wouldn't realize the chance of me being a ticking time bomb. We called the surgeon, the specialist. It's called a Mohs procedure. So what Mohs is with skin cancer. They go to the spot where the biopsy was done. They take a spot, like if the spot is right in the middle of the top of your hand, well, that's probably bad because it's not meaty, that would hurt. I don't even want to imagine it. So say there was a spot right here. They would take, a certain amount of skin, and like the top layer, and the surgeon looks at it under a microscope, acts as surgeon and pathologist, and that's important later. They act as surgeon and pathologist in this case. So there's no like official biopsy report for those. It's just what that specialist is seeing real time right then and there. They document, they do it and say, okay, margins are clear. And if they are, you're done. If they're not, they can do it 2 more times. So I had to schedule with that specialist. The doctor called with my mom and I in the room. She said, I'm going to call right now. I've already talked to them. They know who you are. We called them. The woman answered. She asked for my information. She even, commented that my insurance was great, so that was going to be fine. So she knew who she was talking about. So she said, okay. She's like, wow, he really fills up. He only does those procedures on this day, Wednesday afternoon, and it's Monday now. So I'm like, okay, we're getting in 2 days. This must be serious. It must be as rare as I think it is. And I did confirm that with the doctor who gave me the diagnosis in person. And she had this look on her face of like, she was seeing a ghost, because it was like she knew it was rare. I'm sorry, I'm giving commentary and I'm gonna stop. Oh, it's so hard not to. Okay, I'm just gonna give you facts. Just facts. She calls. The woman's going through. He's got a busy schedule. He's got a full schedule. This is now September 8th. She's like, he can see her October 8th or whatever that Wednesday is of that week, if it's not the 8th, whatever. And I just right away looked at my mom like, this is really rare. This woman is like, we're going to call him. You're going to get in on Wednesday. And now she's trying to make me wait a month. My look said that to my mom in a split second. The woman on the phone, or the doctor, was like feeling the same way and said, are we waiting that long? And she said, I mean, it's not cancer. No commentary. And again, I looked at my mom, and the doctor said, yeah, this one is. And she went, oh my God. And she actually laughed. Said, oh, I was looking at the wrong thing. I'm sorry. So then it was actually Wednesday. So I'm like, oh yeah, so it is serious. My mom came with me. I go back. I put a gown on. The doctor looks at it and says, I was there actually for, it is their Mohs specialist, but I was actually there for a deeper biopsy to see more of what we were dealing with. And when he looked at it, he said, I thought I was going to see tumor left, and there isn't any, so there's not really much to biopsy. So we should just go forward with the Mohs procedure. That way you don't even have to wait for a biopsy result. You just, I'll be able to tell you today. I look at it, I tell you. And they explained how it worked. That was how I knew. I mean, I explained it to you before, but that's when he explained to me how that procedure was going to go. But he said, this is the best thing to do. Okay, so I had already signed consent for a biopsy, so now they needed me to sign consent for that, and he was saying, this is the best thing to do. We should just do it. We'll have results today. What person is not going to say that? I signed the paper. Okay. I get my gown on. He comes in. He's got his little surgical marker, and he says, okay, where was it? I said it was right here. Like, I'm like looking, pointing, whatever. And I'm like, oh yeah, see, like when a scab falls off, it's not quite healed yet. It's not quite scar. It's like in that weird, and like the scab just fell off, so the skin's a little bit of a different color. And I said, well, you see that itty bitty, because it was so tiny where it was actually connected. You see that tiny scar? And he's like looking and like whatever. And he's like, is it like right here? And he starts going down, and he draws like a big, like marble sized spot. And it's like a full centimeter too low and like to the left. So it's like all areola, because that's what my paperwork said, was that I had this on my areola, but it was not on my areola. It was on my nipple. He circled nothing anywhere close to my nipple. And I said, yeah, that's way too low. And I'm trying to show him. I mean, it was tiny, but it was like not microscopic. Dude, you look in a microscope all day. He couldn't see it, but he's like, he like wipes that off. He draws another spot, and he's like, oh, does that look better? And I'm like twisting it and moving it and looking. And I even looked at my mom, and I'm like, does that look better? And she's like, I think so. And we're like trying to pull up the picture that I had initially sent to her to like make sure it was like at least even top. And like, we're trying to tell him where it was. Okay. We were not just confirming, we were telling him where it was. He had no images, he had no measurements, he had nothing. Okay. And the crazy thing is there was some sort of measurement for location. If you hear snorting, Gus is out here with me. There was some sort of measurement taken from the first doctor who removed the original tumor for triangulation purposes. Why that wasn't used, I don't know, but it was never used. It was never, we went on my word and a picture that I found initially in which the tumor was big and looked like it was attached also to my areola. But it wasn't. It was only attached to the nipple, and he was taking a spot that was primarily areola. There was some nipple, the side where it was removed, but I don't know if he took the spot where the scar was, because even while it's healing, I can't really see. I mean, it's almost all the way healed, but I can't see that spot. But I also, that spot was already so close to healed that like I don't know that it was going to scar. It was so small. So I'm not sure if he got it or not. And that's important here, because every single document in my chart says areola. And everything in every document, other than the real science-y stuff about like after he removed it, what he did with it, I'm sure that's correct. But everything else in the notes about what he says happened is completely untrue. So up to this point, it looks like he did everything completely by the book, and he may have, other than the conversations that he should have had with me first to actually have me give informed consent. And if he had done all of that, then a lot of these questions wouldn't be in anyone's mind. So again, no, I'm jumping ahead, and I'm remaining cryptic on purpose, because I'm trying to just give facts. When that's done, they cover me up. I go in the waiting room. You have to wait like an hour for them to like, I think they like freeze them, and then they put them under the microscope and he studies them. But there's a full waiting room. It's okay, Gussie. Gussie heard a car, scared him. It is a full waiting room on this Wednesday morning, because this dude is like apparently the best, and it's full. So he's probably doing a lot of stuff in between all of that too. So I sat for an hour. I get called back. I don't know if the person that calls me back is like a medical assistant, is a nurse. I really don't know. I am not like saying that to be disrespectful. I'm saying I don't know. That's just, I don't know. We get like barely through the threshold into where the patient rooms are, So we're still in a full waiting room. And she says, "You're good." So I assume that means that I'm good. Like, hey, good news. Can't really tell. She's like got no tone of anything. Just matter of fact, "You're good." Okay, what am I good? He's ready for me? Like, what's good? Okay, so I don't want to get my hopes up, but I'm like ready to text everybody, "I'm good." Doctor comes in. She uncovers it, takes another picture. Or takes a picture. That was the first picture after he had done it that she took. She took one as he started, and she took one while we were waiting for him to come back in. He comes in the room. He's like, "I have great news. You're cancer-free." Fantastic. I did skip over the most important part in the beginning, and I don't know how I did that. Yes, I do. I'm high. Sorry. That's also raw and real me. When he tells us, he's not going to do the biopsy and explains how that surgery is done, he says, "I'm fully confident that I could close it, but you are young and you have a husband, so you should go to a plastic surgeon to get it closed." And I said, "All right." And I'm thinking, oh, my husband has to deal with it, but okay. But I'm taking the word of this surgeon who is the best, and he wants to send me to the best plastic surgeon, so I'm assuming there's a reason. Until he says like 5 or 6 more times that I have a husband, so my nipples should be symmetrical, so I need to go to a plastic surgeon. And like my mom was in the room with me because, I had taken a Valium before the procedure, because I don't know if you've ever gotten lidocaine injected anywhere to have like a skin tag or anything removed, but it's incredibly painful and burns like hell, like this fire that I was sitting too close to, and it burns so bad, and I had to get it in my nipple. So, I took a Valium in the morning. So he tells me that a bunch of times in front of my mom. So I'm glad my mom was there, because I would have thought that I dreamt that, because it was so ridiculous. And like the first time I just didn't understand what he was saying. The second time I kind of laughed because I thought he was like trying to be Mr. Funny Guy. When he said it like the 10th time, I'm like, this dude is a piece of shit. But you know what? If he's a piece of shit who knows how to do his job, I'm cool with it. So fast forward now, he told me cancer-free, margins are clear, fan-freaking-tastic. He starts talking, and the next little piece is going to be me reenacting how he was saying it, and you have to think of somebody who 2 days ago found out that you had a very, very rare form of cancer that at the time I believed happened to 10 to 15 times per year, and 2 days ago that happened. This morning you had it removed, and now he just told you after 2 days that you like this rare form of breast cancer, like you're good. So I'm Valium headed and happy, but like overwhelmed and like processing. I don't know if this is word for word, but this is how that conversation went. So put yourself in that mindset. I'm going to give you a second to get yourself there. You took a Valium. 2 days ago, you had super rare cancer. Now you don't have any cancer. And you took a Valium. Did I mention you took a Valium? Because you took a Valium. Cool. All right, here we go. Okay. So like I said before, I know you said you don't care what it looks like, but I'm confident I could close it. I am. But you have a husband, and I would prefer you go. And if it were me, I would want to go to a plastic surgeon to get it closed. And I said, okay, like if a doctor's telling me if it were him, he would do it, I'm still, okay, I'm going, whatever, tell me where I gotta go. And he's asking me where I live. And I said, I live like right across the street. My neighborhood is like very close to this place. He asked me where somewhere down in Atlantic County. I don't remember what town he mentioned. I'm gonna not give more commentary there. But he wanted me to go see this plastic surgeon about an hour away because he's the best. And I said, okay, fine. He said, I couldn't talk to him yet because he's in surgery right now. But when you leave, I'm going to give him a call. And then they're probably going to get you in within like 48 hours because that'll be a good timing. They'll get you in within 48 hours. If they don't get you in within 48 hours, then you can just take the bandage off and wash it once a day, put some Aquaphor on it, cover it up. But they're going to get you in. I know they'll get you in because he's the best. You really want to go see him. So they'll definitely get you in. But they'll call you to set up the appointment, whatever. And my mom was not back in the room with me, just so we all know. So he just like word vomited all these things on me with my care instructions mixed in. But I'm so happy that he said cancer-free that I don't really give a shit where I have to drive to get this perfect plastic surgeon to give me perfect even nipples, because since I started breastfeeding, they weren't perfect anything nipples, but okay. They were good breastfeeding nipples, I guess, but they were not symmetrical even to begin with. So cool, this perfect plastic surgeon is going to give me symmetrical nipples again. Ask them if we can get a lift while we're there. Ladies, it's the sweat, I'm telling you. So he says all this. I'm like, cool. Can't wait to hear from them. They call me back. The guy doesn't take my insurance. I'm positive it's going to be a ridiculous amount of money, but I asked for a ballpark estimate. She can't give it to me because she doesn't know all of the clinical information that she would need to know to give me a better estimate. I'll call you tomorrow. And I said, well, I'll be okay waiting until tomorrow, because like he said they would get me in within 48 hours, and he made it sound like they had to get me in within 48 hours. And I didn't want to like hang up with these people and not be able to get a hold of anybody. So I said, okay, fine. She said, I'll call you in the first thing in the morning when the two doctors can talk. We can get all the reports. We'll be able to tell you. Okay. She calls me back and she gives me this long spiel about how important it is and how sensitive those areas are, all these things. So with all that being said, it would take a little bit of time. So it would cost you around $2,000. I went, yeah, that's not going to happen. I'll just have him close it up because I really don't care what it looks like anyway. And I told him as much. Thanked her very much. She said, if you need anything, call us back. I won't be doing that, but you're very lovely. Thank you very much. Hang up with her. Now, I had my mom as witness to the first part because I'm still feeling crazy, but she was there and confirmed all of these things for me. So I still feel crazy, but she did confirm it. Hey, guys, here's neighborhood dogs barking. So now Molly is my witness, because the next morning I went with her to drop my best little boy Aiden off at school, and they obviously called me back after, like, while I was in the car with her. So because I called him and said, yeah, $2,000 ain't gonna work for me. His nurse calls me back. And it doesn't sound like the same woman, so I don't know if she's a nurse, if she's a receptionist. I don't know who she was. Again, not bashing, just don't know who she was. Her name was, I'm going to call her Gabby because I don't want to give anybody's names. Gabby calls me and she tells me that, and I said, I don't understand why he can't just close me up. He told me that he was confident and he cared about the looks and he only cared about what my husband thought of what my nipple looked like. So can you just why can't he just close it? He said he could. Why can't he? I don't care if you cut my entire nipple off. Just close it. I'm like carrying around a stuffed animal to block myself from getting hit by a child, a dog, a soccer ball, whatever. She says, I'm going to get him and I'll call you back. Okay. Phone rings. 30 seconds later, he calls. And he said, well, you know, there's some reasons. Oh, and he's working out of North Jersey. So that was part of the reason why he couldn't close me up this day, the second day. So he calls me and he starts to say there's a lot of reasons why a plastic surgeon really should do it. And I said, I'm going to stop you right there, because if you say one more thing about my husband and how he feels about my nipples, I'm going to lose my mind. I am a freshly 40-year-old. Like, the original biopsy was done before I turned 40. Freshly 40-year-old mother with a rare form of breast cancer that you are now stressing me out even more about. I just want this closed and done with. he starts explaining that they typically leave these wounds open for something that is called healing by secondary intention. I don't know the science behind it. He explained it. Basically, they just let it heal on its own because there's less risk of infection, there's whatever. But with a nipple, he's saying there's things that need to be connected. And I know you're done having kids, but there's milk ducts. But I'm thinking, like, even though I don't need the milk ducts to work, that there's like a certain way you need to sew around them, or so. I don't know. He's like, and if it's pain you're worried about, take a Tylenol. No commentary. No commentary. No commentary. No commentary. But there's commentary. Stop being a sissy and just take yourself some Tylenol. Who cares that you got a marble-sized hole in your tit? Just take some Tylenol. No commentary. I said, okay. He's like, and sutures hurt worse and whatever, but we'll find you another plastic surgeon. I said, yeah, I would love that. Thank you very much. She calls me back, his nurse, whatever, Gabby, calls me and says, we found another plastic surgeon. Oddly enough, it's 2 minutes down the road from the original office, so still like a minute away from me, just in a slightly different direction. And she gives me all the information of who they are, where they are, all the things. Specifically says to me, and if you need anything, they'll be happy to help you from this point on. I said, great. I want nothing to do with you either, because they were absolutely dismissing me at this point. But the appointment with this person is now 1 week from the original date of the surgery. So on the 17th, I had it done on the 10th, which also happened to be my 14th wedding anniversary with Clay. What a way to celebrate. Get a big chunk of your tit cut out. I'm sorry. I can't. No commentary. So I go on the 17th. It's just annoying at this point that apparently if you are coming for a consultation on a procedure that is purely cosmetic, that consultation is free. If you have a giant chunk that was cut out of your boob for cancer, you have to pay, in case you were wondering. But I love this doctor. He was hysterical. He was busting on me about how ugly my husband must think my nipple looks. He thought the guy was ridiculous. He said, you're really boring. I thought this was going to be a lot cooler when I read your diagnosis because of the rarity. And he was in his 60s, partially retired, said he has never in his life seen one of that situation. He's seen that type of cancer before. He's never seen it on a nipple, ever. And he's in his 60s and partially retired. So how long does that mean that he was working? 35 or 40 years as a doctor doing these things. He was a plastic surgeon, but he's also a plastic surgeon that does a lot of cosmetic or what's thought to be cosmetic removals like mine, and does not that Mohs procedure, but like deals with these things too. So he's seen a lot of things in his life and never saw one of these. He said, so I recommend you go to a breast surgeon. I said, yeah, it's funny that you say that because I've been thinking that anyway, because I'm just not comfortable with him acting like this was like an open and closed case. And at this point he said, it's fine. It's healing. There's no infection. You don't care about the looks. There's two reasons to open it back up. There is the look, which you said you don't care about, so that's out, and a sign of infection. There isn't one. So we don't need to, I can go back in there and I can repair it and it would look beautiful, he said, but it's going to look just fine. It's not that big. Cool. Let's go. Even better. He said, I'll see you in 2 weeks just to check and make sure it's good. But if there's no signs of infection, anything like that, you're good. Perfect. That's what I wanted to hear. So I go to the front desk and I'm like scheduling my next appointment, and the woman said something to me and she said, you know, it's really annoying. She said, these dermatologists, they send people here for procedures like this, but before the people get here, they have their appointment, and before they get here, they're calling us and they're asking us questions like about their health or about how to take care of the wound or whatever. She said, and we can't help them. Like we legally can't help them because we've never seen them before. Like they're not our patient until we see them for the first time. And I said, It's odd that you say that, because the nurse who set up this appointment for me straight up told me, and I confirmed with Molly that this is what I heard, because she was sitting a foot and a half away from me and could hear what was, 98% of what was being said on the other end of the phone too. And she obviously heard my side and the questions that I asked. And and I said, that's exactly what she told me, that you would be happy to help me from here on out. So they definitely were washing their hands of me. So I could stop here, because that's where we left off in 1 week, what was going on. But I started thinking more and more about him saying how rare it is. And I'm going to tell you just a little bit more, because realistically, I'm going to tell you several more sections, because it's been like a month now since this happened. And like at every turn, every step that I try to take forward, something is crazier than the last thing. And I swear to you, I'm not exaggerating. And like, you're going to be the judge of whether I'm being crazy right now with everything that's going on. But I'm going to tell you just a little bit more. I called the breast surgeon, because like I said, I was going to anyway. And like, even they're like, before they answer, their little message that repeats and, circles through is that they'll get you in within 48 hours of a positive cancer result of whatever kind it is. Didn't matter. Like if you had a mammogram, if you had an ultrasound, if you had a biopsy, they will get you in within 48 hours. And they did. This was Wednesday. They got me in on Friday. After I made the appointment, a woman called me a couple hours later and said, did you have any imaging? And I told her I did not, because of the open wound, and that this happened, like I went in to have something cosmetically irritated removed, and it ended up being this, and this all has happened like literally this past week. Like, I had it removed and biopsied, but I found out about it this week, like Monday morning. It's Friday, or it was Wednesday now, but then it was going to be Friday for the appointment. So, and she asked me to send my biopsy results and get my chart. I picked up a paper copy of my chart and just brought it with me. Whatever. I go Friday morning. My mom comes with me, or she's supposed to come with me. We weren't going yet, because this is another part of this that like makes me feel crazy, but I really don't think that I am. That office called, again, not being disrespectful, just don't know if it was a nurse, if it was a receptionist, if it was a scheduler. I have no idea. She told me a name but didn't identify her title. I didn't care. She said, did you have any imaging done? And I said, I did not. I have an open wound that is healing but isn't healed, and I don't care if it would be okay for me to get a mammogram. I'm definitely not comfortable. And she said, well, without any imaging, she can't do anything for you. And I said, what does that even mean? Like, I have a confirmed case of breast cancer. What? Well, this is really dermatology. And I said, here we go. It is, but it isn't, because it is the way it was explained to me. And it was that plastic surgeon who I loved, who was making fun of how Clay was going to feel about my nipple. He is the one who said to me, this is really rare. And he explained it that it's skin cancer, not on skin. It's skin cancer on breast tissue. So it's like not normal. That doesn't happen. There are other locations in the body. And I actually have a friend who almost died because one of those, it was like neck and tongue. Horrendous, the exact same type of cancer. He went through a horrible battle. He's alive and well and doing great now and has 3 amazing kids, but like, he could have died. So that's like another rare location. So how are we like just comfortable with me? But okay, no more commentary. I'm sorry, I'm almost done. So she says, we can't get you in. And I said, I really don't understand what you're telling me, because I can't get a mammogram right now. Well, no, you'd have to wait 2 weeks. And I said, well, I'm not waiting 2 weeks. Well, I mean, she could bring you in and do a regular breast exam, but I said, I don't need a breast exam. I need testing done. But like, I'm coming in to get her opinion on like what are the next steps for this, because it was recommended from the last doctor who saw me that I come here. She's like, well, let me call her back. And I don't know, she calls me back a couple minutes later, and like I literally, like, this starts as I'm dropping my kids off at school. Like, I can't even drop the kids off at school and then start with this nightmare in the morning. It's got to be like then. So she literally like fights with me. Like, it was almost like she was trying to talk me out of coming when she calls me back. And she's like, well, we can bring you in, but you can't get imaging until she orders it, and you can't, or no, I'm sorry, she can't see you until you get imaging. And I said, well, who's going to order it? Well, she can't order it if she doesn't see you. I said, and that's exactly why I'm coming in, so she can order what she thinks is necessary. No? Like, is that not why I made this appointment? Did she think that I was like going to show up and they were going to do a freaking mastectomy and like that was going to be it? Like, what? No commentary. I'm almost done. So now I'm like livid. I'm like, I am being treated like I'm just like acting like a spoiled brat. Like, I just want to know I'm okay. I'm not doing this. Like, this is commentary, but like, this is literally what it's been every step of the way. Like, I am just overreacting. Like, the attitude that I got from the doctor who did the Mohs procedure and his nurse or whoever, scheduler, whoever she was, and now this woman, and like everybody's like treating it like you don't even have breast cancer, you have skin cancer and it was removed, you're fine. Like what I'm going through is less important. And honestly, like, isn't the rarity of this thing, which we now know is 10 people total, isn't that what doctors want? Like, don't they want like the holy crap, like Dr. House cases that like are a puzzle? Isn't that how they get to write like medical articles in medical journals and things like that, when they get like a rare case, or not necessarily the only way, but like, I don't understand it. I go in, I see her. She like laughs off when I tell her how disrespectful the person talked to me about it, because even if she didn't say anything wrong, her attitude and her lack of care when you're talking to someone who's young, who was just diagnosed with rare breast cancer and is terrified for their life, and the doctor, who's supposed to be a very reputable doctor and I was referred to them by several people, she kind of like, yeah, well, you know, and like shrugged it off. Like I was just hot and overreacting. Like, okay, all right, maybe I am. Maybe I'm just crazy. Like everybody else has made me feel. Maybe I am. But how that was left was like, this is really a dermatologist situation. And I said, I went to my second dermatologist, because remember, the plastic surgeon is half derm, half plastics. The second dermatologist. The first dermatologist did the original biopsy. The second dermatologist did the Mohs procedure. The third dermatologist was the plastic surgeon / dermatology, and he sent me to you. And now you want me to go back to dermatology when I have seen 2 dermatologists that have sent me to you because you are a breast specialist, because this is rare. I mean, it's not that rare. And she actually wrote in my chart about how I was told it wasn't skin cancer, it was skin cancer on breast tissue. Yeah, I was told that because that's exactly what it is. Like, you're supposed to be the specialist of the anatomy and you're not understanding. Meanwhile, I don't want to tell you the next part, because I want to see if I'm crazy so far. Because the next part takes me into the 100% no, I'm not crazy. So I'm gonna hold back on that one. But there is a lot of question about reasons that I don't trust this doctor, and question about, was this done properly in the correct area? I've got a whole lot and damn near expert opinions that it wasn't, but like can't get anybody to officially confirm that. Like I said, not yet anyway. We're still working on it, and I won't stop till I'm satisfied. But she basically said, there's nothing I can do for you. Get a mammogram in 3 weeks when you're healed, and we'll go from there. But a mammogram is not going to show more of that type of cancer, and nobody's going to cut me open for no reason when it appears that everything has been done exactly the way that it needed to be. And if it was only that this guy was caring like a chauvinist pig more about the look of my nipples and how Clay felt about them. Like, if that was my only problem, I would have been over this that afternoon, because I would have been just so happy that I was fine, that I wouldn't have given a shit. I'd have been like, dude, you're a douchebag, but that would have been it. And that's not where it ended, but it's where he was done with me. Let's put it that way. So as it stands right now, just now will be the commentary for you guys to understand what I'm looking at. As of right now, if you look at my medical record and you look at the diagnosis and his response and everything, I am 100% cancer free. When I give you part 2 of this video that explains the next portion of why I didn't trust him, I think you'll understand why I feel like there's a 50-50 shot that I'm okay. But right now I feel fine. It looks good. It has healed well. It's slightly uneven, but damn, like I said, breastfeeding made me uneven anyway. It's been a wild ride. It's been a frustrating ride. I have spent the last 2 days, and you'll see some of that when I post the other video with some of the more emotional parts of this for me. You will see that it's been a rough couple of days for me, because I ugly cry through a lot of it. So I will give that warning. If you're not into ugly crying, that will not be the video for you. But it's been a rough couple of days, because where I am now is, yes, physically I'm okay. Mentally, I am so far from okay. It's ridiculous. And there's so many reasons why. Because at this point, it's been proven to me by every doctor that I've talked to, basically, that like the only way that I'm going to get anywhere on this is by figuring it out myself. I do have a mammogram scheduled for Wednesday. I do have an appointment with Cooper Skin Cancer Clinic, MD Anderson in Voorhees. So all my Voorhees peep, what up? I'll be there now. But this is the problem. It's not until the 30th. So I do have a friend who reached out who is trying to work with someone she knows to get me a sooner appointment. So what up? Hope that happens. But if not, any of my Voorhees friends that want to see me, I'll be in Voorhees on October 30th. Yeah, so that's where we are. Okay, I just heard my family scream because they're all watching a movie together. Want to say thank you officially to all of the people who have reached out to help me. If I get their permission in another video, I will be thanking them directly, because there are people that... Hey, come here, Gussie. He's my protector outside. There are people who have reached out to me that have had no obligation, no reason to feel required to do that, no reason to feel like they should do it, other than they're like being good people. And that's awesome, because that's literally the only way that I'm getting through any of this, is through people who have reached out and been like, however, in whatever way, supportive, just have been supportive. And whether it's offering like suggestions and help and recommendations and everything else, like, or just like, hey, I don't know what you need, but if you need anything, I'm here. Like, all of the people that have reached out to me, I really do appreciate it, because it's been a really weird spot to be in, that feels like I don't fit in with someone who was diagnosed with breast cancer, but I don't think I really fit in with someone who was diagnosed with skin cancer and had it removed 2 days later. Because it's been a mind fuck, man. It's been a mind fuck. If you made it this far to the end, you're the real MVP. I tried to keep the commentary to a minimum, but I'm long-winded. I can't help it. So, you the best. I love you guys.